Hello everyone, I welcome you all to my YouTube channel. Myself Dr. Vipin Vijayan, I am a pain rehabilitation specialist. Today, our topic of discussion is about fibromyalgia. How many of you have heard of the term fibromyalgia? Or how many of you have experienced the problems with fibromyalgia? It is basically a generalized pain disorder which affects all part of your body, especially usual complaints are neck pain and lower back pain. It is associated with severe tenderness of your muscles. As soon as someone touches your muscles, you will feel terrible, extremely severe pain. All the rheumatological and neurological investigations will be normal. This is the main problem with fibromyalgia. Usually it is very difficult to diagnose fibromyalgia. It is basically a diagnosis of exclusion. That means you should exclude all other conditions which have similar complaint like fibromyalgia. Then only you will diagnose the patient is having fibromyalgia. Otherwise, you may be missing some other treatable causes of such pain. Usually, the patients complaining of severe pain, especially in the morning, they will be having some early morning stiffness, especially their fingers, aching pains over your neck. Sometimes it may radiate to your shoulders and fingers. Sometimes you will be having some numbness of your fingers also. It usually associated with neck muscle cramps, usually your calf muscles, and in the morning you will be having heel pain. That is, the heel pain will be a typical kind of pain. You will experience a severe kind of pain as soon as you touch your feet to the ground, especially in the morning, and it gradually wanes off as you are walking. Similar kind of heel pain happens when you start walking after sitting for a long time. This may be usually associated with plantar fasciitis or retrocalcaneal bursitis. These two are the common causes of heel pain. What is the reason for fibromyalgia? Females are more affected with fibromyalgia. What could be the reason for fibromyalgia? For many years, it has been considered as a psychological issue. That is, the patient will be complaining of severe pain. On all investigation will be coming a normal. Then gradually the patient will end up in a psychology counseling table. But in the recent studies, we have identified that some of the neurotransmitters like norepinephrine and serotonin are deficient in such patients. This may be the reason for their hyperalgesia, that is increased sensitivity to pain. How will you treat fibromyalgia? Basically, you can control your pain. You should maintain some exercises, especially regular exercises, which you should be doing regularly, and you should be giving more importance for your proper posture and position. That is also important. As a part of initial workup, we will do all the investigation for rheumatological conditions, and if the patient is having severe neck pain and lower back pain, we will do the investigation for lumbar spondylosis and cervical spondylosis. Sometimes MRI to rule out the intervertebral disc problems is also may be needed in some cases. After that, usually all the investigations will be normal in fibromyalgia. Then we will advise some postural correction to the patients, especially for the neck pain and lower back pain. They should modify their daily routine. They should modify your using of their smart gadgets, etc. Along with that, we will be giving some exercises, that is therapeutic exercises, to improve the muscle function. For neck pain, we have to give some neck exercises. For the lower back pain, we usually use spinal exercises. And if the patient is having knee pain, we will improve the quadriceps and hamstring muscle strength. Then for the heel pain, we usually give a plantar stretch exercises, especially in the morning. But the thing is that as soon as the patient gets relieved of the pain, they will stop doing exercises. This is a very common situation we usually see in our daily practice. But this should be avoided, because as soon as you stop your exercises for a long time, then you will be losing all the positive benefits you have achieved through the therapeutic exercises for the last so many months. So it will be very difficult to get a restart. So ideally, you should continue exercises. For the pain, we usually give some pregabalin or duloxetine kind of medications. They usually have some sedations, but usually the patient will be having some sleep issues. So this sedation won't be much problem for the patients. This is a very brief introduction regarding fibromyalgia. Feel free to comment your doubts. We'll meet you again with another topic. Till then, bye, take care. Thank you.